The meniscus is a padding between the thigh bone and the shin bone, and it acts as a shock absorber as you walk or jump. And stretching is very important to opening up that gap between these two areas to alleviate pressure off the meniscus if it happens to get injured. Hi, Dr. Malka here, your chiropractor and acupuncturist, practicing in Los Angeles, California. And today we're going to start off by trying to straighten that knee. Because oftentimes during a meniscal tear or injury, you'll find that the knee won't straighten all the way. And in fact, there's an orthopedic test called the bounce home test that tests it where I have the leg drop down, and if it causes pain, we know it's positive for a meniscal tear. So oftentimes, your knee will be kind of stuck in this position. So you want to go ahead and try to straighten it. And if you need to, get your thumbs in there and just push that knee down to try to get that knee to straighten completely. And often just by doing this, you can kind of slip that meniscus back into place. And another way, if you want to try to get the knee straightened and just use gravity, is to just turn around like so and just allow the knee to just drop over the side of a bed, or in this case, a massage table. So the knee will want to be kind of bent like this. And so we're just going to use gravity to just drop it down. And if you feel like you need a little more weight in there, you can just use ankle weights and just put them around your ankle and just allow that knee to straighten out. Secondly, to open up that knee and to gap that joint, you're going to want to roll a towel, put it behind the knee like so, and then just slowly sit back on your heels. And by doing this, you're going to gap this knee joint. And maybe at first, when you do it, you can only get down to here. If that's all you can do, that's fine. Be gentle to your body. But at some point, you'll want to just sit back all the way on your buttocks and just gap that knee. To intensify this stretch, you'll want to unroll the towel, put it behind the knee, create some tension like so in front, and once again, slowly drop the buttocks back. And you should be able to feel the gapping in the knee. Bring your body up and drop it down. And you can repeat this 3 to 5 times, holding it for 30 seconds or a minute. So next we're going to stretch the calf muscle, because the calf muscle comes up here and crosses the knee area. So when this is really tight, it can compress the knee joint. So you can use a belt, a strap, a dog leash, and just hook it around the bottom of the foot like so, and just pull the toe towards you. I always say bring the toes to the nose. And then the way I like to stretch the best is stretching against resistance. So why this foot is stretched back like this, I want you to push against the belt with 10% of your strength. So you're doing this motion, but you're not going to see it because I'm not actually changing the range of motion. I'm just pushing against the strap or belt with 10% of my strength for 10 seconds. Relax. See if you can stretch that calf a little bit more. I think I did it a little bit more. And then push for 10 seconds with 10% of your strength. And then relax. Go ahead and pull it towards you. And just keep repeating this until you feel that calf is nice and stretched. One reference you can do is stretch the other calf and just make sure they're even, because if this is the injured side, the chances are this calf might be a little tighter. So you want the stretch to feel the same on one side as the other. Continuing on, we're going to continue with a hamstring stretch. Because as the calf comes here and bisects the knee in this direction, the hamstrings come and bisect the knee in this direction and attach here. So again, belt, dog leash, strap, bring it on the sole of the foot, have the other knee bent just so that it'll take pressure off the low back. And then bring, with the knee completely straight, bring the knee to the nose. And once again, with 10% of your strength, you're going to do this motion, but without changing the range of motion. So at 10% of my strength, I'm going to push down towards the table and resisting it with the strap or the belt. For 10 seconds with 10% of your strength. And again, oh look, I improved my stretch. With the knee straight, push again. For 10 seconds with 10% of your strength. And relax and bring it closer. Lock the knee out and push. For 10 seconds with 10% of your strength. And you'll feel the stretch here. And so what I want you to do also at this point, which is a really good gauge, is compare it to the other leg. So if the other leg is a lot more flexible, you want to continue to stretch this until you get it even with the other leg. And you may not be able to do this just the first time you're stretching. It may take a few days for this leg, which is injured, to be equal with this leg. And then you know you're making progress. And then finally, we have the quad stretch. And I'm gonna use the other leg just because it's closer to the camera. So we're gonna hook this around the leg like so, lay on your stomach, and you're gonna bring the heel to the buttocks. And once again, just like we did with the hamstring, you're gonna be pushing against the strap in this direction, like you're kicking a ball. You're bringing the foot down towards the table, but you're not actually changing the range of motion. So you push against it for 10 seconds with 10% of your strength. Release. Try to bring it closer to the buttocks. And again, push it for 10 seconds with 10% of your strength. Relax. See if you can bring it closer to the buttocks. And then again, push for 10 seconds with 10% of your strength. And you can keep repeating this 3 to 5, 7 times until you feel that muscle releasing. And once again, you want to compare it again to the other thigh because you want them to be even. So sometimes for some people, maybe they can only get their heel this close to the buttocks and it's even. As long as it's even on both sides, not everybody's going to be flexible enough to put their heel right up against the buttocks. So anyway, continue to do these and I hope you have happy knees. And if you like this, make sure you subscribe, make a comment, give me a like, and we'll see you next time. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.